another viewer question. This one is on acid reflux, and it's a video question from Jenny. Let's hear it.
Hi, my name is Jenny, and I would like to ask the doctor if acid reflux is more common in men than it is in women, and if that's the case, why? I would also like to ask if drinking a lot of water reduces acid reflux. Thanks.
Thank you, Jenny. Great questions. Doctor, what are your thoughts here?
Well, yes, Jenny, these are great questions. So for the first, it does seem that men and women both have acid reflux. And the differences that have been shown in some studies is that men tend to have more of the complications of acid reflux. So what are these complications? This includes inflammation in your esophagus, so the lining in your swallowing tube can get inflamed and even have ulcers. That's called esophagitis. There can also be Barrett's esophagus. This is a change in the lining that is a risk factor for a certain kind of esophageal cancer. Very rare, but it is linked to Barrett's esophagus, which is linked to acid reflux. So men tend to have more of the side effects or these complications, which are not very common, but definitely can happen. There's not a sense that men have acid reflux more frequently than women or are more likely to have it. There's one theory that women have their acid reflux diagnosed and treated earlier because they're more likely to see a doctor, and men may be more likely to ignore symptoms and avoid doctors. So it might be more a difference in when people present. As far as the drinking water, no, not really. Staying well hydrated, of course, is important. As we enter the summer months, we certainly don't want to get dehydrated. But drinking a lot of water itself isn't going to help your reflux. But there are some lifestyle type changes that are important. So it has been linked to being overweight or obese, and even if people have very modest weight loss, a lot of times their acid reflux symptoms decrease. Certain foods can trigger it for some people. There's been a lot of talk again about coffee, as Penny was asking. So the link in research between drinking coffee and your acid reflux getting worse is actually not very consistent. So we might still be okay with our coffee, Jenny, if you like coffee too. Certain things like peppermint can increase your reflux, and sometimes different people have different trigger foods. So what bothers one person may or may not bother another person. It's also important if you're having reflux at night to really avoid eating before you lay down, really about 2 hours from the time you eat till you lay down. And that will help with symptoms that can happen at night when you're in bed and even wake you up.
We have another viewer question from Jackie, who also reached out.
Love this question, and she's dealing with pain, which is unfortunate. I think I have an irritable bowel. I have bouts of constipation and diarrhea. I read that constipation causes diarrhea. Is that true? And what would trigger this? Foods, hormones, or just being unlucky? Sometimes I don't eat if I know I will be out for a while for fear of having to run to the bathroom. What is a good treatment for this? Oh my goodness, doctor, we have to help Jackie.
Jackie, it sounds like you're going through a lot, and this is very complicated. So we'll see some of the things we can talk about here to help explain it. Of course, anything this complicated, you should be working with, your doctor to help with the best management. But first off, irritable bowel syndrome, IBS, is very common, and one of the variants of it, because there are a lot of different symptom groups that fall under IBS, is this alternating diarrhea and constipation, which actually can be quite difficult to control or manage. As you can imagine, if you just have constipation, you can treat that and get to, a nice steady state. And if you have diarrhea, you can treat that. But if it's alternating, it makes it more challenging, which brings us to one of your questions, Jackie, and that is, does the constipation cause the diarrhea? And really, it doesn't, but it can feel that way because if you treat your constipation with foods or medicines to help you go to the bathroom, it's very easy to overshoot where you want to be. And next thing you know, you're going to the bathroom far more frequently than you want to. So I think what you're getting at is, as you're trying to manage one, it's very easy to tip over into the other. Then there's the, well, what's causing this? And I can understand, Jackie, while you're wondering, because this is clearly impacting your quality of life. It's impacting, your ability to do activities and timing of eating with getting anything else done, which can be, very disturbing and disruptive. So there are a lot of things that can cause diarrhea and constipation. And in the bigger sense, what's going on with irritable bowel syndrome, there's really a number of things that could be going on, and they can be in combination. So there are things like hormones. For example, many women notice that they have more diarrhea or less constipation if they tend towards constipation during their period. So bowel changes during your period because of the hormones is very common. Food has a huge impact on whether you're having diarrhea or constipation. And there are some links between different things in diet and irritable bowel syndrome or irritable bowel syndrome type symptoms. There's also some thoughts that your gut might be more sensitive, hypersensitivity. And there's thoughts of motility. So that's that tube, that muscular tube that is your intestines, how well it moves, how well it contracts to move things through could be not normal and causing symptoms. So there's really a lot of potential things that could be causing the problem. There's also a thought that the normal bacteria and other organisms that live in your colon, if they're out of balance or not in an optimal combination, that can contribute, which is why there's a lot of interest in, for example, in probiotics to help. So in some, Jackie, there's a lot of reasons you could be having some of these symptoms. There's a lot of things that could be directly impacting them, including food, medicine, activity, hormones. And it's a very common problem. So I do encourage you to talk to your doctor. It can be embarrassing to try and talk to your doctor about, having to run to the bathroom or just talking about it. A lot of people, it's one
Sure.
thing if they're checking your blood pressure, but if you're having to talk about these things, but don't be embarrassed. As my kids called me a poop doctor. We've heard it all. So please, get the care you need.